Deliverance and medication-assisted treatment saved my life.
MAT officially stands for medication-assisted treatment. It is a medication that helps a medical disease. Because sometimes you get a patient who's interested in and motivated to be in recovery, but their brain has been hijacked. And while they're sitting there trying to get this information from the counselor, from their sponsor, from a meeting, their brain is out saying, where am I going to get my next fix? So sometimes you need to quell that first and say, okay, I can't stop thinking and doing this, so let's put a brake on it. And now that I've got your attention, and now that you're not jonesing, now that you're not in withdrawal, now let's start talking about what has happened in your life to get you to this point.
I started using in my late 20s. I was in and out of jail, rehab, kind of everything. I was homeless. I lost my older 2 children. I was divorced then. And I was living on the streets, and I found out I was pregnant. I had a social worker and I had a caseworker who called me all the time, and when I blocked her phone number, she emailed me, and when I blocked that, she would show up at my doctor's appointments, and eventually it clicked. My MAT was Suboxone. It was a strip that I had to take, and it was to block out any opiates so that I wouldn't go through withdrawal and so that I wouldn't be able to use anymore. I stayed on that for my whole entire pregnancy. After I had my daughter, I stayed on it for a few months also, and then I actually switched doctors and I was put on the once a month Sublocade shot. But if it wouldn't be for something, for the MAT, for my Sublocade, for when I was on Suboxone, I would never have been able to stop. I would have never been able to go about my day and be a normal person and not have to worry about how I was going to get my next one so that I could just get by the day. I'm actually able to get up every morning, not be sick, get a shower, get dressed, take care of my daughter, and do everything that somebody else would do that wasn't an addict the same way. And now I actually get to be a part of that instead of that stigma of being an addict and being nothing and worthless and everything else.
Stigma is all around us, and more than just an addiction, but I'll focus on addiction. And it is so rampant, it's even within the community, within the recovery community, which is horrible. There are less now than there were before, but there still exist meetings that will not accept patients who are on medication treatment. You can't come in here because you're not really in recovery because you're on that fill in the blank. We shouldn't be arguing of should it be medication or non-medication. You're going to need all the pillars that are in the non-medical treatment. Absolutely, you're going to need those. But what's wrong with, in order to get those pillars, that you need and utilize a medication so that you can help accomplish that? And I think we need to remember that all of these people that they're demeaning, they're somebody's son, they're somebody's daughter, possibly somebody's mother or father. They are people first, and the disease that they now have is ruining their lives, but it doesn't make them any less of a person.
If you're considering MAT and you're not sure, I would definitely at least contact a doctor, caseworker, anybody that knows any information in it, or somebody that's actually on it themselves, and be able to talk to them, ask as many questions as you want. And I mean, if something else hasn't worked, that may actually work for you.
Addiction shouldn't define anyone. Support helps. Stigma hurts. Take the first step in breaking through the stigma of addiction at sosberks.com/addiction. Paid for with Pennsylvania taxpayer dollars.